Hello and welcome to this video on the different types of research studies in Epi and Biostats. This video is going to be the first in our series on Epi and Biostats. My name is Dr. Wahab Fazal and let's get into it. We'll start with a very simple type of research study known as a case study. What is a case study? Let's understand this with the help of a simple example. When a medical student eats a poisoned apple, he is brought in to the university ER where a student physician is going to take care of him. The student physician finds this to be a very peculiar and interesting case. He wants to write a research paper on it. This is a case study. A case study is a research paper written about an interesting or peculiar case that is presented so other people get to know about this type of presentation. When you write the same thing about a series of cases that presented with the same kind of presentation, that is a case series. So let's take the same example, a series of poisoned apple eatings in a medical college presenting to their ED. That's a case series. Simple as that. Let's move on. What is a cross-sectional study? Well, this picture right here is not just due to chance. This is exactly what a cross-sectional study is. You take a cross-section of an apple, you count the number of seeds in it. That is exactly a cross-sectional study. It's one point in time, you look at a population, you cut through them and you ask how many people have diabetes. They say out of a population of, let's say 1,000, 800 have diabetes. That is exactly what a cross-sectional study is. Similarly, if you want to know how many in this population are smokers, so you cut the population, you ask everyone how many people are smokers and they tell you these many people are smokers. That's a cross-sectional study. Let's take another example. So this is our friendly medical student known as Paul Mercurius, and he wants to know how many people in his medical college have depression. So what does he do? He finds out that around 50% of the medical college population tests positive for depression on the PHQ-9 scale. If his medical college has around 500 people, around 250 people have depression. This is prevalence. If you know how many people currently in a population at one point in time have a particular disease, that is prevalence. So his professor asks him, how many people in the medical college get depression every year? Can Mercurius answer this question just on this study? No, he cannot answer this question. Why? Because cross-sectional study can tell us the prevalence, but the professor's question is asking about a concept known as incidence. Exactly. That's how many people get depression every year. That's incidence. A cross-sectional study is not good at telling us that. So, something else that a cross-sectional study is not good at, let's figure that out here. So, Mercurius is thinking that most affected students are from the senior years of medical school. Right. Is that an association? How is that not a causation? Cross-sectional studies are not good at establishing causation. Why is that? Well, the causative criteria are very strict. We will talk about that in a future video. That's known as the Bradford-Hill causality criteria. And there are very specific criteria that you have to meet for something to be causative of something, for an exposure, for something to be causative of a disease. For him to establish a causative reason for the study, he needs to do a cohort study. Let's talk about a cohort study with the help of an example. So now Mercurius wants to know how many people get depression in an academic year. He wants to know the incidence now. He knew that the cross-sectional study was giving him prevalence, but it's not giving him incidence, the people getting depression. For him to know how many people get depression every year, he will have to follow these medical students. So that's exactly what he does. He follows the medical students from first year through fourth year. What is the exposure? So let's talk about exposure. For every disease, there is some kind of causative reason, right? There is a causal link to that disease happening. Let's take the example of, let's say, lung cancer. So we know that smoking has a causative link to lung cancer. It meets that criteria, right? So If we talk about smoking, smoking in this case is the exposure, which causes the person to develop the outcome, which is the lung cancer. So if we look at this example, how many students, medical students, develop depression? So the exposure, you can say in this case, is just being in medical school. Being in medical school causes you to develop depression. We can't use the word cause right now. We want to know if that's the case. So being in medical school, can being in medical school cause depression? Being in medical school in this case is the exposure. That is the exposure. What is the outcome? Well, develop depression. The disease, depression, is the outcome. So this is the exposure, this is the outcome. Now, Mercurius is thinking, he has to make two groups. In a very good, like a good scientific study, he needs to have two groups. One is his main group and the other is his comparison group. So how will he make the comparison groups in this case? You can pause the video and you can try to think about it. So in a cohort study, the groups are made on the basis of the exposure. They're made on the basis of the exposure, meaning one group will be in medical school and the other group will have to be maybe in business school or engineering school. These are people who don't have this exposure, right? I removed the outcome part here because the outcome part is irrelevant while Mercurius is making the groups, and this is exactly what he's thinking about. So let's, on the basis of exposure, cohort 1 will be people in medical school and cohort 2 will be people outside medical school, maybe even business school, right? So what he will do now is that he will follow up both of these cohorts of people and see if they develop the outcome or not. Interestingly, there are two ways that you can do a cohort study. One is that you can take a group of people and you follow them up for a period of time. That can get expensive. You know, you have to incentivize people to stay in the study. They have to stay in the study for a particular amount of time to see how many people actually end up developing the outcome. So let's take the same example of smokers. You would have to follow up some smokers. I don't know how much time they will need to actually develop lung cancer. Maybe it's a decade, maybe it's 2 decades, maybe it's 3 decades. So you'll have to keep following up on them. It gets really expensive. And see if they develop lung cancer. Or something else you can do is that you can find out all of the smokers in a community and see how many of them have lung cancer. So let's talk about both of these processes. There are two ways to do a cohort study. One is the prospective cohort study. Prospective cohort study. The other one is the retrospective cohort study. Just remember that the retrospective one deals with the past. Past, right? If you remember that retrospective deals with the past, you will easily remember that prospective deals with the future. Exactly, prospective deals with the future, retrospective deals with the past. Let's take an example. McNosey follows cigarette smokers to see who develops cancer in the future. What's our exposure in this case? I'm repeating this again and again for you to understand this is how questions work. They want you to know the exposure, they want you to know the outcome, then they want you to understand how do you make the groups on what type of study this is. So he follows the cigarette smokers and sees who develops cancer in the future. In a retrospective study, Mercurius looks up cigarette smokers in health records to find who developed cancer, not develops, who developed cancer in the past. That is a retrospective study. You, on the basis of exposure, people who are smokers, which is in this case the exposure, and see who actually developed cancer in the past. Let's take a different example. So I'll give you just off the top of my head, people who eat a lot of oily foods, end up getting cardiovascular disease. Let's say that is our hypothesis that we want to know. So there are two ways that you could do the same study, right? One is that you could follow up a group of people who eat a lot of oily foods, see if they develop cardiovascular disease in the future or not, right? This is the prospective way of doing the same study. And the other way is that you see in the community all of the people who have had a lot of oily food and see if they have cardiovascular disease. This is a retrospective study. Let's move on. Just know that cohort study focuses on the exposure or the risk factor, and on that basis, our cohort groups are formed, the comparison group is formed. Why am I focusing a lot on this? I'm focusing a lot on this because this contrasts with the next study that we are going to talk about. This type of study makes the groups on the basis of the outcome. People with the outcome are in one group, people without the outcome are in the other group. Let's look at it in detail. Diseases are random. Cohort studies are expensive. Just do case control, man. Just get people. What are you saying, that I have to follow up people with who are smokers for decades to find out if they get lung cancer or not? Why don't I just get people with lung cancer, ask them if they smoke or not? Well, that's simple enough. What's the problem with that? Let's take another example of what is a case control study. A case control study deals with people who have the outcome, take a comparison group of people who don't have the outcome, people without the outcome, and you just look for the exposure of interest. So remember, a case control study groups people on the basis of having and not having outcome. A cohort study groups people on the basis of having and not having exposure. I know this is confusing. Let's take an example to try to explain this. Do people who spend more time in the library get better scores? So I want you to pause the video here and get me these 4 things. 1, what is the exposure in this study that we want to do? What is the outcome in this study that we want to do? Then I want you to make the case and the controls, that if you wanted to do this in this design, in the case control design, what would be the case and control? And then 4th, if you wanted to do the same study in a cohort design, what would be the cohort and the comparison group? You can pause the video here. So the exposure in this case is time spent in the library. Exposure is the time spent in library, because if you read this sentence, people who spend more time and get better scores. So people are being exposed to this time spent in library. What is the outcome? Getting better scores, therefore outcome is better scores. If you had to decide on a case and control, you decide on the basis of the outcome. So people with good scores would be the cases. People with bad scores would be the controls. If you had to design the same thing, for a cohort study design, then you look at the exposure, you look at the time spent in library. So people who spend more time in library would be the cohort group, and people who spend less time in library would be the comparison group. This is a very tough topic to understand. If you want to go back and watch this part of the video again, you would understand how we make cohort groups and how we make cases and controls. Let's talk about ecological study. Ecological studies are studies that are conducted at a population level. These are studies that are conducted at a state, at a county, or at a provincial, basically a large group of people. When you take multiple large groups of people and you look for particular numbers, let's take an example to understand this better. If you take the BMI levels from all the states in the US and you correlate that with the number of fast foods stands, and if you see that, maybe the states with a higher number of fast food stands the people in there have higher BMIs, you want to find out the correlation. Is there a correlation? Well, the question that is usually asked is that in ecological studies, let's take an example. Dr. Fluffy reads about this correlation in the paper, that states which have higher fast food stands the people in there end up having higher BMIs. So can he ask his patient to move to a state with less fast food? Well, the answer to this question for the purposes of your exam is no. Ecological studies, as I said, are conducted on a basis of large group, on provinces, on counties, on countries. The results of these studies are not applicable for an individual basis. So if an ecological study was conducted that people who live in a particular borough of New York as opposed to other borough of New York are more obese, That does not mean that the individual that is presented to your clinic right now is obese without looking at their weight reading, right? It's like that. You cannot make specific individual conclusions on the basis of an ecological study that was conducted. So let's look at the takeaways from this lecture. One by one, case study, case series, or cross-sectional studies are not great at establishing causality. Causality has a specific criteria. We'll talk about that in a later video. Cross-sectional studies can tell you the prevalence, but not the incidence. Cohort studies can tell you the incidence. Cohort groups on exposure. You make the cohort groups on the basis of exposure, and then you see if they develop the outcome in the future. That's a prospective cohort study. You see if they developed the outcome in the past. That's a retrospective cohort study. Case control study groups on outcome, meaning you take the people with the disease, you call them the case, and you take the people without the disease, you call them the control group. And then you look for the exposure. You take the people with lung cancer and without lung cancer, see if they smoked or not. Case control study is affected by recall bias. Take the same example. If you ask people with lung cancer if they smoked or not, odds are they're going to say yes. Ecological study can cause ecological fallacy. That's the word I did not use because this is a tough word. I wanted to save it for the end. If you're making individual conclusions from a study conducted on a larger level, that is called an ecological fallacy. Don't make ecological fallacies. Cohort studies use risk ratio. Case control study use odds ratio. I've just added this here for the sake of completeness. I'll talk about this in more detail in the next videos. So let's do this question now. I'll read this with you. A researcher is investigating the association between the high-fat diet and development of type 2 diabetes in adults. She enrolls 500 participants who are initially free of diabetes and asks each participant to complete a dietary questionnaire detailing their typical food intake. Okay, so she's taken in 500 people and she wants them to complete a dietary questionnaire. They don't have diabetes right now. They're then followed up for 10 years to observe who develops type 2 diabetes. At the end of the study, the researcher compares the incidence of diabetes between those who reported a high-fat diet and those who did not. What type of study this is? You can pause the video here if you want. The answer to this question is a cohort study. Let's see why this is not the other option. What's a case control study? Well, if this was a case control study, we would have taken people who have diabetes and who don't have diabetes in the start, because case control study works on the basis of having the outcome. And we took people who were initially free of diabetes. So it's not a case control study. What's a randomized control trial? It's not a randomized control trial. Well, because we're not trying out anything. I'll have a separate video. If you're wondering why I did not talk about randomized control trial in this video, because I have a different video on what's a randomized control trial and the different phases of a randomized control trial. Is this a cross-sectional study? No, because we're following people up for 10 years. A cross-sectional study is just like cutting an apple in half. It's not like following an apple to see if it, withers or not. I don't know if it wilts or not. I don't know the word. But cohort study. Is it a cohort study? Let's think about it. There are people who are initially free of diabetes. Okay. Then we follow them up for 10 years. And then we see if they develop the incidence of diabetes. That means if diabetes happened or not. Then we see if they developed the outcome or not. That sounds a lot like a cohort study. Is it an ecological study? Was this conducted on a state, on a province, on a country's level? I don't think so. We just took 500 participants and we followed them up for 10 years. So yeah, that makes the answer a cohort study. A recent study analyzes data from multiple countries to assess the relationship between average alcohol. Okay, just from the get-go, did you read this? Multiple countries. I'm not going to spoil this, but you get the gist. Between average alcohol consumption per capita and the incidence of liver disease. The study finds that countries with higher average alcohol consumption tends to have a higher rate of liver disease. After reading the study, a physician concludes that every individual who drinks more alcohol has a higher risk of developing liver disease. This sounds like Dr. Fluffy's work. Which of the following best describes the study design? So let's go through each one of these. Is this a case control study? Well, I don't think so. We did not make groups on the basis of control on outcome. We did not have cases and then we did not have controls. We just looked through data. We analyzed data from multiple countries, and we just compared this between different countries. So this is not a case control study. Is this a randomized control trial? Are we trying a drug? Are we trying some sort of medication? I don't think so. So it's not a randomized control trial. There's no description of a drug being discussed here. Is this a cross-sectional study? Well, it's comparing the data between different countries. So that sort of fits another study more than what you would call a cross-sectional study, which is just sort of a picture of a particular population at one point in time. It does not compare the data of different populations. Is this a cohort study? Did we follow up people for a period of time? No, we just took in data from multiple countries. This fits. Is this an ecological study? Well, yes, this takes in a larger amount of population, which is we took the data from multiple countries and we want to see if there is a correlation between average alcohol consumption per capita and the incidence of liver disease. So this is an ecological study. That makes a lot of sense. Let's take another question. Which of the following best describes this physician's error? Let's go back to it. So this physician, after he read this study, he concluded that every individual who drinks more alcohol has a higher risk of developing liver disease. What error did this person make? What error did this person? You can pause the video here. You don't have to see the options. So, did he make I'm not going to explain each one of these options because I'm going to explain more about these biases and errors in a later video. But you know he made something called an ecological fallacy. He made an individual conclusion on the basis of an ecological study. Let's take another question. I know these are a lot, but these help you understand the whole thing. A team of researchers wants to investigate whether a new medication for hypertension causes a reduction in cardiovascular events. Okay, new medication, if it works or not. They need a study design that allows them to establish causality between the medication and the outcome. Which one of the following study designs would be the most appropriate for establishing causality? This is a cheeky one. I know I made this one because this ties into our next video. The answer to this question, you can pause the video here. The answer to this question is actually randomized control trial, because we're trying out this new medication because we want to see it causes a reduction in cardiovascular events or not. I know this is a wrong question. This is an out of course question to ask, but we'll talk about this in our next video. In the end, I just want to say this. Thank you for watching this video. You got this. Go to our next video where we'll talk about a little bit more detail. Thank you so much.